So we're looking at the distal radius, and we find Lissus tubercle. Lissus tubercle, you can put your thumb on it, it's very clear. You then put your probe on it, and then you find your Lissus tubercle, and it's very clearly seen. So we want to now get a central view of the radiocarpal joint. Now, the best way to do this is by putting the Lissus tubercle in the center of your image, and then spinning in the longitudinal plane on that. And then what you should start seeing is you get your lunate, which has a typical shape, a sort of half arc. And then if you go more distal, you should see the typical shape of the capitate, which has this long, is a much longer shape. And then you know that you're in the exact right plane. If you go more distal to that, you're at a metacarpal. But that's basically how you find this.